Okay, welcome back. We are now going to do for practical number 3, the skull. So a lot of these repeat from the full skeleton. So we'll start with the frontal bone, the parietal bones. This is from the rear now. I turned the skull around. The sphenoid bone, you have to open up the skull. And again, this is from the other side. So I've taken off the cap from the rear. And the sphenoid bone is this entire area right in here. It looks like a butterfly. You can also look in your book. There's very good diagrams in your book. This is the sphenoid bone. Putting this back on, the temporal bone is just as it was on the full skeleton. Here is the temporal bone on this side. Remember where your temples are. The occipital bone is in the back here, and this right here delineates the difference or the separation. This is the occipital bone, but you need to turn it upside down because this is also part of the occipital bone back here. Okay. The next thing would be the external occipital protuberance. This is really hard to see, but not when you have it in your hands. It's this bump on the back of your head. We talked about this in the very beginning. This is the external occipital protuberance. The ethmoid bone is inside of the eye. The ethmoid bone is going to be the medial, remember medial, the medial aspect or part of the eye orbit. It's right in here, okay? The palatine bone, think palate, hard palate. Turn it upside down, and this right in here is going to be your palatine bone. The mandible is going to be your lower jaw. On most of these skulls, they are removed or removable, so it's not a big deal if it's separate. You just need to bring it up with you when you take the practical. The upper jaw here, this is your maxilla. Okay. The nasal bone, this is your nasal bone right here. Your zygomatic bone would be your cheekbone. So right here is the zygomatic bone. Okay. We talked about tears before, so your lacrimal bone has to do with your lacrimal apparatus. See this hole right here? You can see this hole in here. This is part or inside of the lacrimal bone. It's right inside, posterior to the nasal bone here. It's inside the eye, okay? If you look inside the nose, you can see a couple things sticking out. There are superior and inferior nasal conchae. You only need to know the inferior nasal conchae right here. There's one on this side and one on this side, okay? When we talk about the sutures, okay, there's sutures on the skull. You can kind of see them right here. These separate the different plates, and these also allow for your skull to grow. You don't grow, you're not born with the size skull that you end up having as an adult. Obviously, you need to allow for growth, and that's what these sutures allow. When you do grow into an adult, they kind of fuse. So these are the sutures. So let's talk about the different sutures. There are 4 of them. Right here would be the squamous suture. It goes from right about here all the way back here. You have the coronal suture, which separates the frontal bone from the parietal bone. So this is the coronal suture all along here. The lambdoidal suture, Turn around in the back, and this separates the occipital bone from the parietal bones from the posterior. So this is your lambdoidal suture, and your sagittal suture goes right down the middle of your skull and separates the 2 parietal bones, and it separates from the frontal and the occipital bone. This is your sagittal suture. On a fetal skull, we do not have fetal skulls, but like I said, you've heard of soft spots. A fontanelle is a soft spot. So where it would be where these occur. You've always seen soft spots on a baby. You are born with cartilage as your skull, as your entire skeleton actually, and you need to allow for growth. So there's these soft spots that allow your brain to grow, and it also allows your skull to grow with it. When you're an adult, they obviously close up. So on the adult skull, you're going to have to point to them where they would be on a fetal skull. So the frontal fontanelle would be right here where the coronal suture meets the sagittal suture. That's the frontal fontanelle. The occipital fontanelle would be where the sagittal suture meets the lambdoidal suture back here. There would be another soft spot or fontanelle here. This is the occipital one. Turning to the side, the sphenoid fontanelle would be where the frontal or coronal, suture meets the squamous suture right here in the front or anterior. So right about here would be the sphenoid fontanelle. And in the back here, where the lambdoidal suture meets the posterior part of the squamous suture right about here, this would be your mastoid fontanelle. And that's it for the skull for you guys, okay?